Thank you. I would doubt, Minister, if there is a family in Ireland that hasn't had someone belonging to them afflicted by a stroke. The effects, as you know, can vary from relatively mild occurrences from which people can do make full recoveries, to devastating attacks which greatly impair quality of life for the patients and also for their carers. Once we viewed strokes almost as an act of God. There was nothing we could do except sit and hope that sufferers would regain some functionality. Thankfully, we've come a long way since then. Last year, as the Minister will be aware, the Irish Heart Foundation published ESRI research showing that 750 extra people could be saved from death or lifelong dependency each year at a cost saving to the taxpayer of €230 million over the next decade if stroke unit care and clot-busting thrombolysis treatment was generally available. The HSE accepted this research and in fact allocated an extra €4.2 million to stroke service in the 2011 service plan to fund the appointment of 45 clinical nurse specialists and therapists posts countrywide. These were in addition to a number of new consultant neurologist and geriatrician appointments that are currently being made. 2 of these posts were approved, Minister, for Drogheda, a clinical nurse specialist and a therapist, with the full expectation that these posts will be filled early this year. We're now almost at year end and these posts are apparently no closer to being filled. It's essential to understand that an effective functioning stroke unit is made up of people, not just buildings and equipment. A stroke unit requires people with the necessary expertise who together offer a holistic approach to patient care. Done properly, Minister, the results, as you know, are spectacular. Both in terms of recovery of patients and, crucially, reducing the likelihood of further attacks and incidences. Without the required expertise, there may still be a sign on a corridor saying stroke unit, but it will not meet the guidelines for what constitutes a stroke unit as envisaged by the Irish Heart Foundation and indeed the ESRI, and the benefits and the savings will therefore be lost. We're all aware of the difficult situation this country is in, but this isn't a case of looking for any additional resources. The budget for these posts has already been approved. What's more, these appointments will greatly improve the effectiveness and efficiency of our stroke care system, saving money and freeing up resources to meet other demands in the health service. This is a win-win situation, Minister, and it's deeply frustrating to see such a delay in implementing a measure which would greatly improve quality of life for patients and their carers indeed. I would appeal to you, Minister, this evening to give this your full attention and ensure that these 2 essential appointments are made as quickly as is practicable.
The Minister's 4 minutes.
Grateful to the Deputy for raising this issue. As he knows, I would have an interest in it, and again, through family circumstances. Following the transfer of acute services from Louth County Hospital to Our Lady of Lourdes Hospital, Drogheda, the HSE has worked to reorganise stroke services in the Louth Meath Hospital Group. Stroke services in the group were prioritised by the HSE in the 2011 service plan. A dedicated consultant physician lead for stroke services is in place in Louth Meath Hospital Group. The consultant physician is progressing the planned development of the stroke service in line with the HSE's National Clinical Programme for Stroke and is working with the programme's national clinical lead in this regard. I am pleased to say that stroke services in the hospital group have been significantly improved this year, with the designation since March of a 7-bedded area for acute stroke patients in Our Lady of Lourdes Hospital, Drogheda, and the introduction of thrombolysis for acute stroke patients last July. An 8-bedded stroke rehabilitation unit has also been commissioned in Louth County Hospital for appropriate patients from Our Lady of Lourdes, Drogheda. Admissions to the area are coordinated at weekly cross-site multidisciplinary meetings. It is planned to increase the capacity of this unit to 11 beds once recently appointed speech and language therapists have completed a period of upskilling and induction. A draft Louth Meath implementation plan for the National Clinical Programme for Stroke has been developed. Discussions are ongoing with the consultant physicians in this regard, with a focus on agreeing a strategy to ensure that all stroke patients are admitted under the care of a stroke physician with a dedicated on-call rota for stroke thrombolysis. Recruitment to appoint physiotherapy and clinical nursing specialist staff to the service is being progressed by the HSE. Once this implementation plan has been agreed with the National Clinical Lead, the stroke service in the Louth Meath Hospital Group will be officially recognised by the National Clinical Programme. This is a welcome and important step in the development of services at Our Lady of Lourdes Hospital, Drogheda. I would like to emphasise the importance being placed by the Department and the HSE on improving services for patients suffering strokes. The Irish Heart Foundation, as the Deputy has already pointed out, has made some estimate of the economic burden of stroke and a transient ischemic attack TIA in Ireland. They estimated the cost of stroke care at between 470 million and 1.8 million, and said that introducing changes to stroke service provision would have important implications for health outcomes and costs. In June 2010, Changing Cardiovascular Health Policy 2010-2019 was launched. This policy establishes a framework for the prevention, detection and treatment of cardiovascular disease, including stroke, which seeks to ensure an integrated and quality-assured approach in their management, so as to reduce the burden of these conditions. The policy proposes that cardiac and stroke services to be reconfigured on a network basis at hospital and emergency care level. It is planned that each network will provide specialist services by a blend of hospitals designated as local, general and regional comprehensive centres. As part of these plans, an improved ambulance service will ensure that 80% of patients will be brought directly to the appropriate centre for initial treatment within the accepted criteria framework. In order to help implement the report, specific teams have been established in the HSE. 4 lead clinicians, 2 of whom have responsibility for stroke, have been appointed by the HSE to direct the implementation of the recommendations. The policy acknowledges the key role that primary care plays in raising awareness in risk assessment and management of cardiovascular disease. A shift to community-based care is envisaged for such patients, with primary care teams providing structured, proactive care supported by specialist ambulance services. I welcome the important development in relation to stroke services in Ireland, and in particular the important role that Our Lady of Lourdes Hospital Drogheda will play in the future. But I do accept fully that the outcomes, Deputy, could be enormously improved if we had a proper service in place. And it seems that with the programme now envisaged of 9 stroke units around the country, and with the proper expertise, and particularly the thrombolysis, but not everyone is necessarily an ideal candidate for this, the outcomes could be so much better, and the burden that stroke can place both on community, on the individual and indeed on the state could be huge.
Deputy Nash, do you wish to come back in?
Thank you, Cathaoirleach. Thank you for your comprehensive reply, Minister. You've acknowledged some of the developments that have taken place, not just in relation to additional resources for stroke, but in terms of changes of attitude towards stroke and stroke prevention and all sorts of other interventions. But I mean, the fact remains that an extra 4.2 million was allocated to stroke service in the 2011 service plan, and there was an expectation that those 2 positions, the clinical nurse specialist and the therapist, would be allocated to Our Lady of Lourdes Hospital in Drogheda. As I said in my earlier statement, a stroke unit is not just about a building or equipment. It's about interventions, the type of which can be provided by the clinical nurse specialist and the therapist. And I think you personally would accept the need for such interventions and for such staffing arrangements. Now, my concern is, and I'm not so sure if the question has been satisfactorily addressed, but can we expect those positions to be filled by the end of the year, as per the plan and as per the resources allocated? And if that is not the case, can a commitment be made that those positions will be filled very early next year to deal with the very clear demand in the North East and in the Louth and Meath area in relation to these sort of interventions for stroke?
I can't obviously give you an answer to that a very specific question, but what I will do is I will bring your concerns and I will find out the answer for you, and I will refer to you in terms of those very specific areas. I think you're quite right. If we're looking for multidisciplinary teams in relation to other chronic diseases, then I think that we will have to introduce it here as well. You know, the recovery or the outcomes in relation to stroke can be so much better if the correct and speedy speedy diagnosis and treatment is put in place. And I think that's really what the plan is about. I think the plan is a good plan. I think the network that we're going to put in place around the country is a good network, and it will serve the needs of those who either have suspected or who in fact have suffered a stroke. What we do need to ensure is that the personnel that are required in order to deliver that plan are put in place, and I will inquire for the Deputy as to when these 2 appointments are to be made.